Hey everybody, I'm Steve Cook, and I'm usually with David DeMuzio, and he's not here today. I'm going to try to do this on my own, try to give you some information about hair restoration. A lot of the questions that come through these clinics is the FUT, FUE questions, the constant back and forth between which is the better procedure, which procedure should I have done, which procedure is better for me based on my hair type, my loss patterns, my willingness to use medication or not. A lot of these questions I'm going to try to help answer today. Let me start off by saying a full disclosure that I like to represent doctors throughout the country, some outside the country, that do both procedures. Now, why is that? I just feel that there's always going to be some sort of a discrimination or prejudice, whatever word you want to use, toward a procedure that you actually do and you only do. And there's some fantastic FUE doctors that do only FUE in the States. There's also some fantastic doctors, hair transplant doctors in the States that do only FUT. When I'm trying to help people with hair loss, I like them to get an unbiased opinion. Now, we're here in Austin, Texas today at Dr. McGrath's clinic, McGrath Medical, who everyone knows I do a lot of work with. And he actually does about 50-50 FUE, FUT. What I really like about his presentation is that he's not biased in either way to offer you an FUT today or an FUE tomorrow or a procedure that may not be right for you. So I'll start off by saying that what is kind of confusing to the newer patient that's just starting to research online, the FUE procedure is not the newest technology. It's not the latest and greatest. They like to put it out there because it's a little bit more of a sexier procedure because there's no linear scar. But when they group it along with the machines and the machine companies that make robots and different ways to extract tissue, they like to throw it out there with words like algorithm and software and computer programming and robots in order to kind of capture your interest that this must be much of a superior procedure than the procedures where the doctors are removing tissue by hand. That's absolutely not true. The most important thing to take away from this video today is that which procedure do you qualify for? Which procedure is the best for you? I'm here today to help you with your research, and by the end of this video, maybe give you a little insight in what questions to ask when you're shopping for your hair transplant procedure. One thing to keep in mind, which is very important, is believe it or not, most people, a lot of people that have hair loss are not good candidates for FUE. That might sound insane, because the internet and the marketing and advertising talks about how this procedure can help anyone. But when you do go to a board certified doctor that does do both procedures, I would say 75 to 80% of the time, most of us with hair loss are not qualified for an FUE procedure. The first reason why we may not qualify for FUE is just poor donor hair. I mean, look, if we're gonna build a house or pour a foundation for a home, it's all about the raw material, and then it goes into the skill set and the quality of the workers and construction team and whatnot. But the raw material is where it starts. When it comes to hair restoration, a lot of it is predicated on the quality of the donor hair. You know, because your barber tells you, your stylist tells you, whether or not you have thin, fine, poor quality hair, or whether you have thick, strong, super ropey type hair in your donor zone in the back of your head. Well, those that have that thick, strong hair back in the back are better qualified for FUE. Across the world, the top 3 hair types in the world are Middle Eastern hair type, Spanish descent, and African American. However, African American have much less density than even most Caucasians. So let's just stick with the Spanish and the Middle Eastern. Now, I'll take myself as an example. My whole life, not only was I cursed, or I should say I got the lucky gene when I was in my teens, but I also have very poor hair. The donor hair is challenged. I think it's Western Europe is where I'm descended from. So my hair is not strong. Right out of the get-go, I would be considered not a great candidate for FUE. And it's because of the trauma that's put on the tissue when they extract it out of the back of the head. It's put under a lot more stress than when an FUT procedure is done. Now, a lot of clinics that, of course, only do FUE are going to tell you the opposite, and that's where this gets confusing. Again, I'm here to give you objective information that will help you make a great decision. We have to be very careful in who really qualifies for any hair transplant procedure. As the American Board of Hair Restoration Surgeons continues to train doctors and offer board certifications, a lot of the questions are centered around very young patients. Now, I had my first hair transplant when I was 19. That was a long time ago. Things have changed since then. And these doctors have an obligation to make sure that they're the adults in the room. They're the ones with the medical licenses. So when you're really young, problem with that is that we don't know where you're going to go hair loss wise. We don't know how bald you're going to be or how much thinning you're going to have. We get a good idea by about at age 25, 26, but we just don't know. So that's where FUE, which again puts a lot of trauma on the grafts, and FUE, which doesn't allow us a lot of hair to extract over the course of your life versus the FUT, can become a problem. So one of the red flags with FUE is if you're very, very young, you might want to hold off or at least visit one of these doctors that are, again, board certified, do both procedures. It can guide you on whether or not this is for you. We just talked about if you're too young to do a procedure. So let's say, I'm going to talk out of both sides of my mouth. Let's say that you're young, but you have Middle Eastern hair and it's super strong and ropey, and you have very little hair loss, and you're a great candidate for FUE. Your dad or your uncles, no one in your family has hair loss. We know you got the gene from somebody, so we still don't know where you're going to go, but things are looking good right now when it comes to, a hair transplant for someone with these kind of qualifications. The one problem is, or potential problem is, are you going to stay compliant on the preventative treatments? So I am not a big fan of doing any surgery on anyone under 25 that is not willing to be compliant on the preventative treatments. Well, no one knows what the future is going to hold and how life changes, so we don't really know for sure. You don't even really know for sure. What we need to know before going into a hair transplant is, are there any side effects from the medication or the topicals that you're using? So you need to be on the medication, topicals, about 4 to 6 months, just to make sure that your body acclimates to it, which is about 99.5% of the time with these young people. Once we've accomplished that goal, we can move forward to then again assess which procedure is going to be better for you. So if you're very young and you have very little loss, but you're on the preventatives for at least 6 months, then you can be that exception where you can qualify for FUE. If you don't think you're going to be compliant, or you really don't know where you're going, or there's a ton of hair loss in your family, you're pretty much a candidate only for FUT. From an ethical standpoint, and the ABHRS and how they look at the young patients. The next line item I have of either qualifying or not qualifying may not make any sense to you, but I had to throw it in there. So we've been talking about promoting, advertising, marketing, a lot of things where the internet and the different mediums to bring you information is always going to seem like the FUE procedure is the better way to go. I'm just here to tell you that that's not true. It's not always true. Sometimes it's never true. So you need to, again, visit a hair surgeon, a specialist, board certified, to get information from, because most of the time when I'm talking to people, they tell me that everything they research is the exact opposite of what I'm telling them. Now, I'm not a doctor, I don't have a medical license, and I'm not giving any medical advice, but I've been doing this a long time. So they're pretty shocked at it, but then when they start to dig deeper, it makes a lot of sense. So be very careful about pre-selling yourself on an FUE procedure because it's the sexier procedure. You want to go into it with eyes wide open and understand, again, pros and cons of each procedure. And this is not a knock on FUE. It always seems, even to me, when I'm helping others, that I'm always talking down about FUE and up about FUT. That's not my motivation. My motivation is to help you because I just don't know who you are, what kind of hair loss you have, where you're going, are you willing to use preventatives? So we have to really ask the right questions. So the next point will parlay off of what I just said. You're not going to get a better result with FUE. If you go to one of the doctors that do both procedures, very well, that are full-time hair doctors, that are board certified, that have been doing this at least 5 years, and you feel are very good at it. And you can call me, text me, and ask me, and I'll tell you, yeah, I think that very highly of that doctor. That doctor is going to tell you that you're going to get the same result with either procedure. So it does not matter. The scarring is what the difference is. But when it comes down to it, if you're strong enough of a candidate for FUE, then you have strong hair throughout the back of your head. If you're not a candidate for FUE, then obviously you're not going to get the best result from either procedure. So let me explain that. If you're a qualified candidate for FUE, then obviously you're a qualified candidate for FUT as well. Those grafts that come out are going to be optimal grafts. That's going to be that great raw material I spoke about earlier. So when the procedure's done, you're going to get the same result with either procedure. The difference is going to be how the scarring appears in the back of your head. That's the only difference. So for today's video, and we'll get into this a lot more with other videos because this always brings up more videos and more questions, and it's very interesting what comes to me from everyone else out there that's looking to do a hair transplant, FUE, FUT, FUT, FUE. It brings up a lot of conversation, which is exciting and cool. Let's talk about flying out of the country to other parts of the world that are offering these cheap hair transplant procedures. I guess my mother taught me something when I was really young and said, if it sounds too good to be true, it probably is. I mean, think about what we're talking about here. We're talking about paying very little money to get sometimes 3 times the amount of grafts as you can get here in the country. The argument on the side of the foreign company is that, American or, North American doctors are greedy and they charge too much money, and doctors that are maybe abroad don't need that much money or need to get started and are willing to do it for less. This is what I know, and I never have a bad word to say about anybody. I'm not going to slam any country or any group of doctors or any other board certifications in the world. What I will tell you is the business model that these doctors are using in these foreign countries does not work for me. What is that? What I'm looking for, and I'll stick with the United States, I'm looking for a doctor that's a mom and pop boutique type atmosphere. These doctors have staff that are very highly paid. They do really good work. This is a team effort, this procedure. And I need to have good staff. And I want to know who's working on me, meaning how long they've been doing this. They're not cheap. So these doctors that know how to get this done right and produce these results, they can't do it all on their own. They're doing 1 procedure a day. Maybe if they have a large staff, they can do 2 procedures a day, but that's even difficult to do, meaning it's a lot of work. And the staff, once you start to expand your staff into 15, 20, 25 of nurses that are supporting the doctor, there's what I call a dilution of talent in the talent pool. And that doesn't work for me. So I'm looking for those small mom and pop. We've talked about it. You've seen my other videos. I mentioned doctors throughout the country, LA, San Francisco, Chicago, New York, Miami, Connecticut. There's different doctors that I feel very comfortable with sending patients who watch our videos to. These doctors are all about attention to detail. What they're charging when it comes to getting a hair transplant is between you and that doctor. I don't even know what some of them charge. But I will tell you that you fly over to a country, you don't know what you're getting into, to pay 1/3 or 1/4 or 10% of what it costs in this country. You're going to be one of 16, 18, 20, 25 patients in the same day. How much staff is that? Who's working on you? This is all FUE. There's no strips being done over there. And they're pulling out those grafts like they're working in a donut shop. That person who's pulling out your grafts, how much experience do they have? What are the guarantees? So what I've seen is, I call like a hair transplant industry urban legend based on what I'm hearing from other patients. Everybody has a cousin who has a brother who knows some guy in the gym that's had an FUE procedure done abroad, and they look fantastic, and they paid nothing. Okay, so good for them, but that just seems to be more of that myth kind of thing, because what I'm hearing is the complete opposite. I'm hearing people that are flying over out of JFK up in New York with 30 people on a plane, and they're all having surgery within the next 2 days at the same clinic. What kind of quality is that? So be very careful. Be very careful when you can't do research. Don't just throw out $2,500 or $3,500 and hope that it works. Oh, well, if it doesn't work, I'll just shave my head. That's not a way to go into this, because you're destroying the hair in the back of your head. And a lot of these doctors that I talk about have to fix that stuff. So be very careful. Remember, I'm looking out for you.